member? I need a volunteer. Who will help me? Thank you. Okay. I'll cover this here in slides. Is that enough introduction for you? We're a short amount of time. Okay, so as I approached putting this presentation and accumulation of materials together, knowing that I only had 45 minutes, I chose to go, let's call it, very wide but not very deep in every area. There's a lot going on, there's a lot to this, and I thought it was most important to share the high-level elements of a daily management system and MDI. I keep my ears open, or try to. Been questions about, what are the differences between the two. So I hope to answer a lot of the questions that I have been fielding or just been hearing through the grapevine. What is this thing that we call DMS and how is it different? There are plenty of contact people in the organization after today if we've piqued your interest and you want to go down this road, that you can have access to all the materials that you're going to see here in greater detail. So with that, I'm going to go ahead and get started. Any questions before? Okay. And I'm pretty informal, so if you have a burning question and it seems like the right time to ask it, just raise your hand and I'll try to field it at the time. So here we go. We won't stop the clock till now, whoever my timekeeper is. Okay. So here's the agenda. Try not to stand in front of anyone. I'm going to start with comparing the elements of MDI to DMS. And the boards are a piece of it, but there's more to it than just the boards, of course. I've got some sample MDI and DMS board layouts. They're over there. There may be some times that if you really just want to stop and you want to get up and go to the boards and look at them, because I don't have everything in the slide deck, we can do that. The bulk of the slides, there's 20 of them, are what I was just calling DMS at a glance. Still pretty high level, but wanting everybody to get an understanding of how we are going about it at Riley. The materials are a blend of what's going on at Riley, what they saw at St. Louis Children's Hospital, what they saw when they visited Stanford in California. So there's a lot of bits and pieces in here, and it's very customized, and I think to some degree you would want to customize yours within the boundaries of that makes sense in each one of your locations. So I'm intentionally showing you some variation. The A3, of course you can't read this and you wouldn't be able to read it on the slide anyway, so I didn't put it up there, but it's out on SharePoint. So this is the governing A3 for this endeavor. And then what I have here, which also is pretty valuable, is the vertical value stream map that they use, and we'll cover that a little bit. I've put all the pieces together. I've put some call outs in here to try to explain what they are, because sometimes, as you know, if you worked on it, if you wrote the recipe card, it makes really good sense to you, right? But if somebody else wrote it, you may not totally understand what was intended. The purpose, which I've already shared a little bit, share both a comparison as well as what's going on at Riley Children's Hospital. There's a couple of other things in here. The Gantt chart, and I put it with a question mark because you might be wondering, if you've got a vertical value stream map, what do you need a Gantt chart for? I'll answer that. And then this that I put out on the table, and I didn't have time to make 30 copies for everyone to have one, but they are what I am calling the 12 most important recipe cards, the milestones, and they're actually the ones that have the comments in them right here. So, but you can make copies of them, and obviously they're part of the Excel file. So, some questions I've been getting, and you don't need to read both sides, they're in the same font and they're in the same color because they're the same. So, characteristics of MDI versus DMS, and on this slide they're all the same. It's both are intended to drive improvement, data-driven and action-oriented. Both are intended to promote employee empowerment, right, from the ground up. We seek organizational stability in many ways, right? That's what standard work is all about. Prevents improvement erosion. So what does that mean, right? We conduct a rapid improvement event, we complete a project, we have a great suggestion that comes out of a morning huddle. but what are we doing to make sure that we don't slip back into our old ways after 2 weeks or 3 weeks or 2 months? An operational daily management board or MDI board will both help to ensure that we don't fall back to our old ways. Both use visual management, follow written standard work, whatever we want to call it, a service excellence statement, right? A statement that's personalized for the department, right? We exist to provide awesome patient care to our children, okay? Written by the people who own the PICU or the NICU, right? But it's important that everybody understands. So my coaching is, don't just put the promise statement up there. I mean, that's kind of easy and lazy. You should come up with your own statement, right? One that's personalized by the team. Why are we doing this stuff? Because somebody making us, or because we believe that following this process will allow us to achieve that service excellence. Involves the entire team in identifying solutions, so not just the boss, the manager, the director, right? Somebody told me to. Doesn't overload the team. So if we're serious about a DMS or an MDI process, we're going to solve the problems when they come up, right? We're not going to wait until they accumulate. Assigns problem solving at the right level. There's an element of escalation management that's woven into a DMS system. Most executives and directors don't want every problem brought to them. But without a mechanism for solving along the way and some sort of guardrails, if you will, when do you want me to tell you, when don't you want me to tell you? So, give me some guidance, give me some framework, and I'll follow it. So those are the similarities. So maybe of more interest are the differences. So measurements are aligned to a VSA, to a value stream, right, in MDI. So we launch a value stream, and somewhere within the first 6 months, I would hope, or maybe even on day one, we're going to prop up an MDI board. That's where their core is aligned to. For a DMS, and we've intentionally at Riley, we started with the metrics for T4 first, right? Well, what do they need to know here so that we can build up and tie to those? So the T1 measurements, they're aligned to T2, to T3, and T4. And that's going to make sense in a little bit if it doesn't already. They're constructed around the true north metric pillars. So if you look over there, that board is an MDI board, and you can see, even though you can't see, there are 5 pillars, right? So there's 5 buckets. We all know that, right? So if you propped up an MDI board, we may not have gotten to all 5 yet, but that's what's behind it. For DMS, they're constructed around quality methods, okay? And that's kind of broad, but that's all of the pillars, but also equipment, supplies, staffing, and safety. And it's a readiness. It's a departmental readiness approach, and we'll touch on that a little bit more. Here, I probably could have underlined it on number 3. Some departments participate, right? If you're in a sanctioned value stream, you're going to have MDI. If you're not, you may not have anything. Over here, all departments participate. It's not optional. It doesn't matter if you're in a value stream or not. If you work in the building, chances are, there's a few exceptions, you will have some form of a daily management board that will be linked throughout the whole organization. Value stream independence, that's my own terminology for if you went on a Gemba walk to 10 different boards in a hospital, you're going to see a lot of variation, right? You're going to see, wow, this looks just as good 2 years into it as it did the first day that they propped it up because they believe in it and they're using it. Now you go to another and you're like, oh my gosh, the date's on here like 9 months old. How come they're not using it anymore? So using it and following it probably is mostly aligned to the department manager, right? Who's leading the department. So it can be all over the place. Over here, there's house-wide dependence. So one analogy I can use here, because everybody's dependent on it, right? Because they're linked. So I was talking to somebody and I said, well, it's like, let's say that you you go to yoga class on Monday, Wednesday, and Friday, and you've been helping somebody whose husband just passed away, and this is part of the therapy, and the two of you are going, and you're kind of mentoring that person, right? And I'll meet you at 5:30. Well, at 5 o'clock, as you're getting in your car, you're like, you know, I got my bag in the back, but I just really don't feel like going today, right? If you were by yourself, you just go home, right? But if you know that somebody's counting on you and they're going to meet you, you're going to go, okay? So fill in the blank. So right here, I mean, I'm at T2. I'm ready to catch this information. I'm waiting for you. You can't just leave me hanging, right? So, and then I've got to take my T2 information and send it to T3 and send it to T4. So, so I'm calling that house-wide dependence versus value stream independence. We can do what we want, right? If we don't do it, nobody's going to know that we didn't do it today, and then, or if we haven't done it for 3 weeks in a row. 5, promotes true north metric improvement. What I'm really focused on here, because this does it as well, but it's got an element of flow. There is a flow element that is part of that daily management system, and you even see it in the center, and is not a function here. Now, you may get some flow characteristics house-wide that come from your MDI, but it's not built around that. Number 6. Put a clock in here. It's time of the day independent. So over here, it doesn't matter, right? What time would you like to have your huddles? Well, I think we'll have them at 1 o'clock, you know, right after lunch. That's a good time to have it in our department. Well, you can't do that over here, right? It's time of the day dependent. We have to have ours at 7 in the morning so that we can send the information to T2 at 8 o'clock in the morning, so that at 9:05 they can send it to Tier 3 to their dash meeting and their daily operations brief, who in turn can. So there's more structure here, right? You can't just have it whenever you want to have it. Number 7, directors and above occasionally participate. They don't have to, right? There are Gemba walks. On this side, they participate every day. The implementation here, most of you have seen it. There's a MDI readiness assessment. Is that department ready to embark in MDI? Well, if you're not, you just wait. Well, over here, we have a timetable, right? We're going to follow a timetable, and when everybody's involved, everybody's involved. This was my list, right? There's probably more things that could go over here that are same, and I'm sure there's more things that are different over here. Yes?
Rayne, do you typically see the two happening together or separate? So for instance, at a departmental level in imaging, would you see them having their MDI time at the same time they're prepping their stuff that goes up to DMS?
Very, very close. Yeah, there's a time window that they have to do it, and a little bit of flexibility, but not much.
Because I was looking at the time of day dependent or independent, just wondering. Okay.
Yeah, and it was intended to show the difference over here, right? And it's also one of the selling points of MDI, right? We don't force people to what metric you have to do. We don't force you to what time. We're trying to make it easy for you to adopt. It's tougher over here. This is more strict. We're telling them what to do. And I've been informed that it's time to move. No. Okay, so again, a smattering of information that I thought you would find valuable. DMS elements. So this is focused on DMS. Daily readiness huddles with problem escalation. Here are the characteristics and the leader's standard work. Success metrics, standard work, right? Each one is going to have critical processes are going to be standardized. Improvement ideas, there's an element on a MDI board for improvement ideas, so that's one way that we promote engagement. There's a planned work cadence that's responsive when there's flow interruption. To talk a little bit about the flow model or the flow characteristics for each one of the departments. There's more. This may be something that you'll certainly want to take away, the definition of what are tiers 1 through tier 4. As I'd mentioned here, predominantly at tier 1, it's a readiness huddle, right? We are a department that the house depends on us for something. Environmental services. They depend on us for food and nutrition. And we want to do our very best work every single day, and we can't do that if we're not ready. That's what this focus is here. Tier 2 is going to have 2 elements. There's going to be, at Riley, there's going to be a clinical Tier 2 huddles where most, if not all, of the nursing departments will assemble, and then there'll be a tier 2 for non-clinical. Okay? And again, all this information will be available to you after question.
Right, for the tier 2, for the ICU inpatient and outpatient specific, is there something that's also driving the connectivity between inpatient and outpatient? That flow, is that part of that flow circle, or is that still kind of a separate?
It is, and that's part of the customization piece.
Okay.
This didn't come from Riley. This came from somewhere else.
Okay.
But if you think about Riley as being it's not the only, but let's call it the only children's hospital, some of the things that they do and don't do might be a little different if you were part of the system. And so that's why we need to allow for some of the customization in the outpatient thing. And that's going to change for Riley because they're going through a construction process where they're going to expand their outpatient offerings,
So that
service lines.
corresponding groups attend that same discussion at the same time, or is there connectivity? Is that at tier
Same
2,
time.
That's the connectivity.
Well, they're gonna assemble with the managers and directors at level 2, and then level 3 would be. I mean, do all of you have some sort of a 9:05 daily operations brief or a dash meeting or whatever you call it? Okay, and we haven't gotten to tier 3 yet at Riley, but we're calling it a remake. Okay, because there's gonna be some customization and changes to it that hadn't been in place. Okay, so maybe this helps with the timetable. So it was a good question, and I thought it might come up. So here's an example, all right? And we're not quite there yet at Riley. So at some point, right, staffing meetings. Some people call them bed meetings, right? Except for they don't really have anything to do with beds. Most of the time they have to do with staff. So in this range is when you're going to be having your tier 1 huddles, right? There's a range in here, but you got to be done in time for the tier 2, either nursing huddle or support huddle. We are not adopting this at Riley at this time, but I thought it was important to share with you. I don't know why whoever called it the no-fly zone, but they call it a no-fly zone. It's a no-meeting zone, okay? We are not going to have any meetings for this 2.5-hour period because meetings interfere with attendance at these huddles that are so important. So some hospitals that have adopted this have put in place the no-meeting zone as well. We are not doing that at Riley yet. We'll see. And then I didn't put tier 4 on here, but at Riley, their tier 4 meeting is at 11:50. Does that help? I take sneezes as yes, that's very helpful. All right, so some more definition. T1 readiness and escalation. So ideally, if our department's ready, we need to be able to anticipate the needs for the day. But I got to know things, right? I need to know the census. I need to know my staffing. I need to know bed availability by bed type. So there's a lot of information I need to know. Am I ready? I mean, if I don't have any idea what kind of a day it's going to be, it's hard for me to know that. Having what we need when we need it, addressing issues. Here is the methods, equipment, supplies, and information. And one simple example over here, right? So T1, many of the organizations call it MESS. Riley chose not to call it MESS. They reordered the letters because they didn't like the sound of a mess, okay? Because it's not a mess, it's organized, so it's just the opposite. But in any event, these are the elements. And you can read them, right? Methods, equipment, supplies, staffing. It's 4 of the 7 ways, right? If we're doing 7 flows. It's part of it in there. So it's not new, but are they doing it in every corner of every spot in your hospital? Maybe, maybe not. They will be if they adopt this. So I put a couple of pictures up here to show you. That's the template that Riley developed. This one over here, and you have to get up and look at it to see all of the elements. That's the template that we went to the departments with, all right? I'm showing you 2 examples. So this this is that. I don't know which department, but it says Readiness, Recognition, and Response Huddle, Tier 1. These are room numbers all around here. There are icons that mean something. So one might be a discharge, an admit, a fall risk. So these little pre-populated will tell you at a glance what's going on in each one of those rooms. Maybe it's surgery, right? This is the time, or maybe the room number where people need to be. Those are the elements. So that's one. So here's another one that looks like it, but not exactly like it. Still has all the same elements in it. It's about improvement, not posting metrics on the board, right? On both sides. So here's just a quick example, which shouldn't be anything new to you, right? This exists in MDI boards and DMS. The True North category, the metric, right? So, we have this already, right? So nothing new there. Standard work. So this slide is focused on, or got some attention directed towards, cross-training in the department, right? So we've got people's names, things that we expect them to do. We're visually posting it. Maybe it was something new. It was a change. So there's a little flexibility on the board. Improvement ideas, again, back to the engagement, pulling people in. This time thing, 10 minutes to the very end?
To the very end.
Sheesh, okay.
You're at 7.
Okay, 7.
You got 25 minutes free, so you're okay. We're going to give you a full 45.
Okay, well, he was. Oh, you were holding me to the original time. No, okay. No, it's this. Okay, thanks. Redo your math. Okay.
Congratulations.
Okay, so of course, and we don't always find this on an MDI board, right? Where's the tack time on your MDI board? What is it? What is your responsibility? Back to well, I don't know how many admits we're going to have today. I don't know how many discharges. I don't know X. I don't know Y. So those are, quote, excuses for why we don't have tack time perhaps on our boards. So it's important, right? We are working to improve our predictability and stability. 10 slides ago, I said promotes workplace stabilization, right? That's what I was talking about. I slid this one in as well because I was very much impressed with it when I went to a Gemba walk in Georgia at the North Georgia Health System with Paul Hout. And so, along with this DMS board, they had in this inpatient unit all of the patients, all the rooms that they were in, and the status of their flowing from admission to leaving the department. And they're making their forecasts of discharges. So most of you in your tier 3 will make a prediction, right? Yesterday we had 22 admissions. We predict 45 discharges today, and so those 45 discharges, if that's the number, maybe this makes up 12 of them, and another department makes up 10 more, and another department makes 13 more. So when they all come together, you're able to see the whole house. We're going to have 45 discharges today, and we're going to measure our forecast accuracy every day, and then we're going to go backwards when we find out, maybe this is best practice because they have this board and they're plus or minus 10% every day, and other departments are just, wild guesses. But it's important. So I wanted to show you, not for you to digest it all, but I wanted you to not to scare you, but just to see some of the complexity that would come together at a tier 2 nursing huddle, right? So you've got a lot of different departments, we've got census and open beds, there's accumulation of things, we've got number of cases, there's a lot of information on there. But these huddles are 10, 15 minutes, because we're doing it every day. And a tier 3 huddle board, I had to cut and paste and splice this thing together to be able to show you the whole thing. Because it's long. a Tier 3 huddle board at the site that I went to in Georgia would probably cover that whole wall over there from end to end. But everybody's, there 5 minutes in advance, and they're flipping their reds and greens, and we're only going to talk about the reds. We're going to follow our standard work. That was Tier 3. This is Tier 4. So these are the executives at that site. They have their own Kamishibai board over here, in addition to, so they're getting ready, right? So a handful of these executives were at the T3 huddle, and they're carrying information forward here that just takes a few minutes to populate on the board so that they can have theirs. Now at this location, they also had, I think it's like 3 smaller hospitals. They're in a region, and those team members or exec teams participate every day. There's a big a bunch of TVs on the wall, right? And so all of them are participating remotely, not just on the phone, but they actually are sitting there. You can see their faces, and they're talking and they're interacting with the group, and they're preparing that. So that was over on this side.
Rayne, where is that, just for reference, who does the bubble?
The North Georgia Health System, in Gainesville, Georgia, just north of Atlanta. Okay, so I'll field questions, and I'll also, now that we do have some time, you can get up and look at these things if you want. I will tell you, I think one of the most interesting is the vertical value stream map. If you're trying to get an understanding of, what is the time frames from start to finish. We conducted our first VVSM the first week of January. So that was what we did here, and you're going to see the recipe cards in those packets if you want to fumble through them. We only got through about the first half of what we wanted to chart in that 3-day VVSM session. But they felt like we did Tier 4 and we did Tier 1. In Tier 1, that was just going to be clinical, just for nursing, ended up with 3 cohorts where we would roll out over 3 weeks. Week number 1, we did, it ended up, it was like 23 different huddle boards and huddle areas. And we covered it over the course of 3 weeks. So we did like 776 or whatever the number was. Covered it 7 days a week, covered it on morning and afternoon shifts. The training was supported by deployment leaders and executives, and it was a pretty long 3 weeks. But at the end of that, we had somewhere in the mid-20s as far as the number of huddles up and running. Then we had our second vertical value stream mapping exercise where we mapped the balance. The plan is to be finished by the first week in January. So this is an 11-month process that we're going through. A lot of involvement from HR for communication, a lot of communication from Dr. Hout and Matt Cook and the rest of the exec team to the directors and managers. We're very close. It'll be next month, and we'll be rolling out the Tier 2 huddles, and then Tier 3 will come following that.
So I've got a question. And we tried to do the shotgun approach, try to get all these places, let's say MDI, and haven't had very good success. I heard something there, I don't know if it's what you meant to say or what you mean, but it seems like if there's not standard work at that Tier 1 location, you can't do this. Is that a true statement, or is that?
It's a true statement.
Okay. So I know a lot of the challenges we have, and this kind of permission I'm asking is, if we're going to a place and they say we want to do DMS, we got to stop and establish standard work before we even go to the next step.
Which was part of the pre-work. So we would go there with a standard work template. But let's say that your department has something a little bit quirky about it. You want to change 4.1 to 4.2, you can add something slightly different, that's fine. I mean, a little bit of change, but no, you don't go in there with nothing. You gotta go in there and say, look, we have a board, but you saw, we don't like blue, we wanna do it in red. Or our space is different, we need, okay.
But we'll go in places and say, I love it when you talked about the service excellence statement. Here's what we do. It's like, great, how do you do it? Well, we all know how to do it. And there's nothing puts out, next thing you know, they don't even know what to talk about. There's no standard.
Well, not only is there standard work, and I don't know that any of my pictures before had it, but many of them, and I'm indifferent on why we made it optional or not, but they're numbers. So if I've got standard work 1 through 10, on most of the boards, and we're probably going to go back and add it, you're going to have a 1 right here in a big circle. You're going to have a 2 over here. You're going to have a 3 over here. Those are the ones that work the best because, and if you're facilitating that morning, you just follow it. You're holding your standard work. You're following the numbers. People are like, well, where are you? It's easy to follow. So Riley has made that optional, and I think they might regret it later. But it's so easy. He's just going to go back and make some circles and put some numbers on it.
Okay, so you're talking standard work for how you run
The huddle.
management.
Oh, no.
Huddle.
Talking about the Gemba.
Process that the huddle
Well, that is,
managing.
yeah, tier 1 is at the Gemba. If you saw in this image over here, where was it? The timetable thing. I didn't draw attention to it, but that. These are at the Gemba. The tier 2s and 3s, they could be somewhere else.
Go another slide back. No, slide forward, I'm sorry. The mass one. But this is where you really pique my interest. It's a method not able to follow standard work. We go places where there is no standard work, so we can't even answer that question. And we push it without doing that first. But if we really said, hey, stop, let's put standard work, and then we could put the board up, then I think that's a big gap that we have not addressed.
So that was an error on the front end by not having it to begin with.
We've only touched, you talk about touching value streams. Okay, we touched 10% with value streams. Other stuff we don't touch, we're still going to put a mess board up. It's like, hold on a minute, let's get those figured out first.
I can't read it on that one, but they all have a standard work. Yeah, I think that's what that said. But even on some of those others, I mean, they've got them. They're hanging on there somewhere.
Can you talk to the transition when VMS rolled out at Riley? What did you do with MDI? The discussion around it to have that focus, or was it?
You're talking about in an area that already had an MDI board. They have both. They have both now, but I don't think in the long run that they will.
So I think historically, or what we've done at West, we've rolled out some MDI got blasted out. Everybody had to have it. Then we started to morph, I guess, components that probably should have been VMS. And we just included it in MDI and said it's for improvement sake. Let's run with it. But if this is going to become something, is there a revisit, redefining what we need to go and say this is VMS and this is MDI? I mean, I guess.